When we were developing the Doctorate in Educational and Child Psychology, we were very aware of a growing area of educational psychology practice which relates to interventions for children's mental health. We considered the sorts of approaches that are available and thought probably the best thing to do was to pick one particular therapeutic intervention and provide resources, teaching and support for trainees to learn about that in detail. Now, there's growing recognition of the increasing incidence of child mental health problems across the board, and many of the young people who are experiencing difficulties will never access mental health services. Most will be attending school, and there are many arguments for delivery of therapeutic interventions in school, so that struck us as something that was also very important. There's also been development and growth of interest in Cognitive Behaviour Therapy, or CBT, and that seemed to us to be a sensible intervention to pursue. So the way we approach it on the doctorate is in year one, trainees will have access to a series of workshops. We cover theory, practice in CBT, and there are lots and lots of practical opportunities for trainees to grow in confidence and competence in working with this sort of approach. We follow that up in year two with a top-up workshop, and then in the spring term of year two, trainees, along with their supervisors on placement, will identify a case, a young person who's experiencing difficulties, that the evidence base would suggest that CBT is an appropriate approach. Trainees will undertake 8 to 10 sessions of work with the young person, supported here at UCL by the provision of supervision from experienced cognitive behaviour therapists. So we disaggregate CBT supervision from the more generic supervision that trainees receive on placement from their placement supervisors. It's a really interesting area of work. It's very current. Trainees enjoy it enormously, and we encourage people to bring all of the skills that they have to develop creative, interesting, intensive direct interventions using cognitive behavioural skills. So it's an area of the programme that we're very proud of, and the feedback that we get from trainees is that it's considered very worthwhile.